There's probably more variation in health during early adulthood than any of the periods we've looked at in the past, mostly because all of these things that contribute to the variations are sort of building up over time and over the lifespan. And so by the time you get to early adulthood, there's really been this accumulation of all these different factors. So you have a really wide variety of health. Compared with a lot of other industrialized nations, the US has higher death rates for all of like the major things that contribute to death. These are some of the top causes, things like unintentional injury, cancer, heart disease, suicide, and homicide. Those are all higher in the US compared to some other, really well-developed countries. So there's variability all around the world, but then of course within the US there's variability depending on a number of factors. Socioeconomic status is one of the main contributing things that determines how healthy someone is going to be and how long their lifespan will be. And that comes from a number of factors. So someone who has low socioeconomic status typically is going to have lower income, lower education, lower occupational status. They tend to have poor health-related habits, so they may not exercise as much, they may eat a less healthy diet. They tend to have poor health throughout childhood, so again that's kind of that accumulating factor. They may have had low socioeconomic status in their childhood, obviously higher poverty rates, which leads to lack of health insurance, and then greater inequalities and health-related environmental factors. So someone in low socioeconomic status is more likely to live in an area that has pollution, things like that. Some of the factors that contribute to overall health are both diet and exercise, probably not surprisingly. So dietary fat is one of the main contributors to things like high blood pressure and other heart and cardiovascular diseases. Particularly saturated fats, or the level of saturated fat in the diet, can contribute to those. It's recommended that saturated fat should only be about 10% of less of daily calories. Saturated fat usually comes from meat and dairy, and it's like solid at room temperature. So like butter would be an example of that. It plays a role in heart disease, breast and colon cancer. Excessive fat converts to cholesterol, which then builds up in the arteries and can cause all kinds of issues. This graph is basically just showing that as the percentage of dietary fat increases in these different countries, you also have an increase in high blood pressure. So it's just kind of one of the data points that shows there's this relationship between dietary fat and blood pressure. So it's better to replace saturated fat with unsaturated fats. So that'd be things like most vegetable oils, nuts, and seeds, and also complex carbohydrates from fruits and vegetables and whole grains. And then of course regular exercise also helps eliminate cholesterol and sort of diminish some of these issues that you have from dietary fat. All right, so probably not surprisingly, exercise can also contribute to overall health, can increase the lifespan. It's recommended that you're supposed to get about 150 minutes per week of at least moderate intensity exercise, particularly like cardiovascular exercise, things like running, other sort of strenuous activities. And in addition to that, you're supposed to have 2 sessions of resistance exercise, like lifting weights or doing some sort of other type of resistance work per week. And most people are not getting anywhere near those recommendations. So less than half of people in the US are meeting these recommendations. Around 40% of people in the US are basically sedentary, like they don't get any activity at all basically. A lot of people know that you should be doing this, but just don't do it for whatever reason. More women than men tend to be inactive, maybe due to differences in occupations, things like that. Inactivity is also greater among low socioeconomic status adults, and probably not surprisingly, overweight and obesity are also strong predictors of inactivity. Typically someone who is overweight is inactive. There's kind of a cyclical relationship there, right? If you're inactive, then that can cause you to gain weight, and as you gain weight, it becomes harder to engage in activity, and so it can become kind of cyclical. So you probably all know that exercising can reduce fat, build muscle, help with things like that, but it also helps in a lot of other areas. So it can actually boost your immune system and your resistance to illness. It promotes cardiovascular functioning, so it helps your heart, grow stronger. But it also has a lot of mental health benefits. So it's been shown that regular exercise can help reduce anxiety, depression, things like that. It also enhances cognitive functioning. So there are studies that have shown that exercise directly enhances basically the neurons in your brain. So it stimulates your brain to grow new neurons, which can help with like memory, attention, pretty much any cognitive function you can think of. It also promotes self-esteem, ability to cope with stress, and overall life satisfaction. And so probably not surprisingly, people who exercise tend to live a longer and healthier life.